Welcome to our 5th episode of AI Watch. My name is Michael Munk. In this episode, we'll be looking into AI in the healthcare industry and such great use cases. One such fantastic project is a project that we do together with Aalborg University and Janus Laust Thomsen. This is a project where we have developed an AI-based solution that are capable of reading Danish and Norwegian patient healthcare records and working with these in an intelligent way. So if you're interested in AI, and in particular AI in the healthcare sector, please continue to watch. Thank you so much.
Hi, my name is Clara. I'm working here at 2021 AI as a project manager.
Hi, I'm Janus Laust Thomsen. I'm a professor at Aalborg University and head of the research unit for general practice. And I'm also working as a general practitioner seeing patients.
And in this episode, we are going to touch upon a project funded by Nordic Innovation, in which we seek to develop an AI model capable of interpreting patient records from different Nordic systems and languages. Besides the research unit of general practice, partners in this project includes Arcada University, Tampere University and NorHEAD. But maybe, Janus, you could start by explaining a bit about the work that you do at the research unit of general practice, especially concerning AI.
Some of the projects started concerning use of artificial intelligence in general practice by the idea of how could we help the clinicians be more efficient and to have a better patient care, especially flow of patients through general practice. So in order to start this, we had a workshop with our colleagues and try to get ideas from our clinicians how artificial intelligence could be seen as a positive helping thing in general practice. Some of the things that came out of this workshop was the clinicians suggested us to focus on administrative tasks. Normally, AI in the healthcare sectors is much seen as clinical decision support, but one of the strengths of artificial intelligence lies in helping with administrative tasks.
Okay, so Janus, maybe you could talk a bit about some of the potential benefits and also maybe some of the challenges that you see through your work, but also in terms of this specific project.
Yes, I see there's very great potential, especially for organizing the flow of patients in general practice. And then we could be much more efficient working as doctors and nurses in general practice if we have the support for administrative tasks from AI solutions. Of course, another big part where AI is very promising is around clinical decision support. There's a lot of different symptoms, especially in primary care, where you have to be very knowledgeable about a lot of different symptoms, and you could benefit from having decision support. One of the barriers comes that they see the decision support is something in the clinical situation, something that they would like the doctors to use. They are very secure about the handling of the data, and but they would very much like the AI solutions be something that is integrated into the clinical solution by a healthcare person, the nurse or the doctor.
Makes sense. So now this project focuses on trying to create more collaboration across the Nordic countries. In terms of AI in healthcare, do you think there's a need for collaboration across the Nordic countries in order to share knowledge and use cases and so on?
Yes, especially among the Nordic countries. The Nordic countries are very much alike. We have the same population, we have the same views on the healthcare systems, but we're also small countries. So in order to drive solutions, especially where you need large data sets, it is very obvious that you need to collaborate. And collaboration also gives new ideas. Then we would be more efficient in developing AI solutions. So one of the great barriers seen for patients is data privacy and security around sharing information from healthcare records. And it's very important for the patients that healthcare data is not leaked. So that's why we need a very secure platform to be able to work with algorithms, and data can be secured in the places where they need to be.
So Janus, now that you mention data security, this is actually a key element in the architecture of this project solution. The way that we ensure data security is by applying the concepts from centralized federated learning. This method will enable the 2 development teams at Research Unit of General Practice in Denmark and NorHEAD in Norway to collaborate and build a solution without sharing data. The patient data will remain in data stores in the countries and organizations of their origin and will thus not be stored directly on the platform at any point during the project. AI model governance, such as governance, assets and controls, is configured on the platform and is then deployed on the project and controlled automatically to guarantee the adherence to both European and national legislation and frameworks around ethical and responsible AI. These integrated controls also ensure that the project access is controlled and only project members have access to the project resources.
Yes, and very important and something that has been stressed by the patient. They feel secure about giving their healthcare data to be used for research and such purposes, but of course they also need to be totally sure that the data will not be leaked anywhere and the use of the data is handled ethically.
Exactly. And all these different rules and security measures is also one of the things that we are, developing here at 2021 AI. More security for patients, more trust in the systems, but also, of course, compliance and governance with the AI models developed.
If we want the benefits from working together from different countries, then we need to have all these legislation, security and ethical use of data in place. One of the beauties, now I'm a clinician so I don't know the technical details, but one of the beauties with federated learning is that you don't need to share patient data. The patient data stays in secure places where they belong, and you are able to share the knowledge about the models.
Thank you so much for listening in. We're both very excited to see what this project brings and the results and the potential benefits and challenges that this project could eventually solve in the healthcare sector. So if you have any questions or want to hear more about the projects, please feel free to reach out to me or Janus.
That was all from today. But before you leave, please remember to comment, send us any question you might have, and not least, remember to subscribe so you automatically will receive a notice when the next episode of AI Watch is available.